What are the risks for the surgery, for having the surgery?
Well, there is, generally speaking, the risks for surgery, there are always in every surgical procedure, of course, there are general risks like bleeding, infection, thrombosis, and everything that's around surgery. So specifically, if we talk about total laryngectomy, one should always be aware of the probability of developing a post-operative fistula, because one have to consider if when the larynx has been removed, then we have to close the pharynx again. So there is always a chance there will be a small leak and the larynx is not closed tightly. However, the good thing is most of these fistulas, they heal by themselves. So if it's a primary surgery without prior radiochemotherapy, then usually one just have to wait a few more days with the conservative treatment, and then this complication can be dealt with very, very easily and very effectively without any additional surgical procedures. The case is a bit more complicated. If we have salvage surgery, then the rates of fistula significantly increase, because the tissue that we operate is not as healthy as without the radiation therapy, and then the local factors for healing are impaired. So one can expect the healing takes longer and that the fistula will be much more frequent. But again, even in these cases, there are very effective ways of treating fistulas, and even with additional surgical procedures that may be necessary. Usually an experienced surgical team will be able to deal with all these complications, and if it takes longer, maybe some additional surgery, but the fistula can be treated very, very effectively. One other thing about the risk of surgery of a total laryngectomy I would like to mention is the implantation of a voice prosthesis. Of course, we after we remove the larynx, we want to rehabilitate the swallowing, and then of course the voice. The most effective rehabilitation method is of implanting a voice prosthesis that creates a fistula between the trachea and the esophagus. And this works very nicely again in the vast majority of patients, but still it's an unnatural fistula with a foreign body in there, and there are cases where this fistula may enlarge over time. Again, especially in tissues that where the local factors are may not be as good. So, but this again is a complication that an experienced team will know, and also for this complication there are effective ways of treating it, but one should always be aware of this special feature while implanting a prosthesis.